Hey, Dave Summers back here with episode 10 of the greatest supply chain challenge in history, global development and distribution of the COVID-19 vaccines, plural. I'm here with Sandy Vosk. Sandy is the owner and founder of Advantage Technology Solutions. His email address is at the bottom of the page. I will remind you of that. And basically, if you want to know anything about supply chain management, either the people, the processes, the technology of it, please get in touch with Sandy. He and his organization can help you. Sandy, episode 10, what are we going to talk about today?
And today, I want to stay on the global theme that we've been rolling with. I think it's really good. And today's episode is about modeling, or, some people use the term benchmarking. And, since I've been motivated by quotes, today's really motivated by Tony Robbins, who I listened to many years ago. And one of the things that he really motivated me with is that if you want to achieve success in life, find somebody who's already achieving the results you desire and model them. I mean, it's like the KISS principle, and it's really true. So today, that's what we're going to talk about, modeling. And we'll get into that in a minute. What I want to do is lead with on March 16th, as we've been doing, what some of the data is on the global basis. And we're now up to 381 million doses in 126 countries. So we continue to rise and over 9 million doses a day. In the US, we're over 109 million and averaging 2.43 million a day. Both steady trends on the up, which is great. But Israel continues to lead the world in distribution by far. It's not even close per capita. 104.3 doses per 100 people. 57.3% of the population, one dose, 47% of the population fully vaccinated.
Yeah. Well, okay, I'm going to play devil's advocate here for a second. Now, we're pals, so you'll take this in the spirit it's given here. But, Israel has a much smaller land mass. Israel's population is significantly smaller than something like the United States. So is it any wonder that they're doing better?
It's a great question, right? How do you compare 9 million and 350 million? But, there are a lot of other countries, Israel's size in the world and a little bit higher, that are still nowhere near it. And I believe there are some fundamental principles that could be modeled or benchmarked as to why Israel's been so successful. And the first one is we'll share this article. You'll share the URL where I pull this information from, and don't take it, off the top of my head. But, one of the reasons is capacity planning. They're the only country I know of that had more supply than needed. They negotiated such great deals that they had Moderna vaccine in stock, and they're only distributing the Pfizer biotech. That's one. They're over capacity. The second is why do they have so much capacity? They paid more and took on more risk. They negotiated a deal that they published. They pay more than the EU, and they were willing to take on the risk rather than put it on the pharmaceutical companies. They absorbed any risk as a country for taking on the vaccines. Pay more, assume more risk. And the third is they were an attractive buyer. And this is really key to me. They agreed, the government, to provide the manufacturers with weekly data. And that data is really it's even more powerful because of the digital network that Israel has. And they weren't just providing information about doses, but gender, age, patient demographics. So it's very valuable to the pharmaceutical companies. So it's not an accident, which is what my point is.
It's excellent. That's excellent. And it's striking to me because people will only hear the one or two things that sort of stick in their brain. You know what I mean? But obviously there's much more to it than that. And you make the critical point of the data that follows the vaccinations and the distribution of the vaccinations. And the efficacy of these things is just arguably more important.
And its value, right? I want to just read a quote from that and why I say they were such attractive buyers. Quote, the pharmaceutical companies not only receive data quickly and reliably, but above all, they get much more data than they would from any other study. And the data is of such great value. So these aren't accidents. These are great principles to model by, I believe.
And I take it that obviously Israel has the infrastructure, the digital infrastructure to make something like this happen.
Absolutely. They have a digitized healthcare system. And again, easier to do in a smaller basis, but still kudos to them for having it and being able to leverage it at a time like this. I mean, you got to give it to them, 104% per doses per capita.
Yeah.
You're doing something right.
Yeah.
And that's the purpose of today.
That's fantastic.
And so, I think it's a good point to kind of leverage the questions about, how can people use this in a personal way? So the first question is, I thought of, do you utilize benchmarks, industry benchmarks to measure your success? In supply chain industry, there's on-time delivery. In manufacturing, there's mean times between failure. For the vaccines, that there are efficacy rates, which are compared, right? One vaccine versus another. So what are you doing in your business against your industry benchmarks? The second is, what executives, and not necessarily in your industry, they could be other industries as well, could be great models for you to emulate. And if you model some of the behavior or strategies they take, they could be applicable and very beneficial to you. And the third I thought about was, really personal, right? Who's the number one person, if you could model them, that would have the most significant impact, positive impact in your life? And that could be business, that could be emotional. One person, and if you could look at it and said, wow, what could I learn from that one person that would impact me now in a significant way? Who would that be and why? I think that's great.
Those are three fantastic questions. And I love the fact how we're kind of doing this yin and yang of it's organizational, it's societal, and it's personal. You know what I mean? I love what you're doing there. Sandy, as always, I want to remind the folks that your email address is at the bottom of the page. If they want to follow up with you on the content in this program or just generally reach out to you, they should use that email address. So welcome to the end of episode 11. Look forward to talking to you next week, Sandy. Oh, did I say 11? Anyway.
It's okay. I had March versus May last time. It's all in the theme of it. So we keep rolling on, Dave. That's
okay. Have a good one.
All right, buddy.